Good morning, everyone, and greetings from Drug Prevention Action Alliance in Columbus, Ohio. I'm very pleased to be with you this morning. Before we get started today, I want to just do a quick housekeeping rules. If there are any concerns with the audio, we are operating with the new system. Please just make sure you use your question or chat box, and I'll make sure to be fielding those as we go through the morning. And as we move forward today, we've had several questions about accessing some of the archived videos in the past. Before I kick it over to Tony, I just wanted to give a little bit of insight for those of you who are looking to go back and access some of the March and May videos that we've had recently. If you go to the Prevention Action Alliance website, if we have tried to make it easy for you by making sure that everything is available right there. So you'll go to preventionactionalliance.org, and then towards the bottom of your screen, you'll see on the bottom right a link to all of our social media accounts. In that area, you will also see that there is a link to our YouTube video. That is the quickest way to get to our channel. It is now under the Prevention Action Alliance banner, no longer under the Drug Free Action Alliance banner, so bear that in mind. Once you click on that YouTube channel, it should take you to a landing page that will look a little bit something like this. As you are navigating this, the most accurate way to look for the videos in chronological order is to click on that tab that says videos. You'll see it right there beneath the blue arrow. If you click on that, everything from our program webinars as well as the SPCA partnership advocacy webinars are listed, and they will be there for the duration. We are working on incorporating these into a SPCA member portal as well to make them a little bit easier, so you'll have access to the actual PowerPoints as well. But in the meantime, we hope that this will be helpful for you as you're sharing these with your coalition members, with your community leaders, and so forth. If you have any other questions, please make sure to reach out to me later. But without any further ado, I will kick this over to Tony Coder for the day. Tony.
Excellent. Thank you so much, Brittany, and good morning to everybody. The archived advocacy webinars are also very good if you have insomnia. They'll put you right out if you listen to them a second time. So, wanted to hearing my voice is very calming, I've heard. But so we've got a lot to talk about for a very light session. The first thing I want to talk about is the biennium budget bill, House Bill 49. It was passed. So for the next 2 years, the budget has been settled, and we know what is happening with the budget. Some things that we have been concerned about did actually go through, which was disturbing, but at this point I guess we'll have to work with them and maybe advocate to try to get them removed later. Interesting process here. So the budget bill was passed by the General Assembly, went through conference committee like it does all the time. However, usually when there are like members of a certain party, in this case being the Republican Party, that has the House, the Senate, and every state office in the state, including the governor's office. Usually there is not this much drama and issues between the General Assembly and the governor. But what happened was the governor did like the governor does every budget. There are some vetoes that they do called a line item veto, where they literally take out lines of funding that are in the budget and erase them from what he signs to make it official. There is also a process where very rarely has it been done, and this was a very big exception, that the House and the Senate can override a governor's vetoes. So if the House or Senate really wants something in the budget, and the governor line items it out, scratches it out, and takes it away from the budget, the House, it goes back to the House. The House can then have 2/3 of its members vote to override the governor's veto and put it right back in the budget. And that's what's happened in I think 8 cases where they went back in, added in some things that they really had wanted in the budget that the governor had vetoed. It now goes over to the Senate, where the Senate has the same opportunity with the Republican Party controlling both the House and the Senate by a 2/3 majority. They have a super majority in both chambers. It's pretty easy that they can get this done. Usually, I can't remember the last time a governor of the same party was overridden by his own party in the House. This is something that is not very common, but it was done this past week. So it now goes over to the Senate. Some of the things that were really egregious and they're going to fight over, I'm sure, in the fall, is the nursing home issue. Nursing homes have been when I was back with Governor Strickland's office and in Job and Family Services, and Medicaid was still there. Nursing homes really were funded very well. In fact, I would get shot for saying this by the nursing home lobby, but they were overfunded to the point where we were paying so many dollars for beds. Empty beds in the state. Governor Kasich, when he came in, made this a priority that we instead focus on folks living in their home health care, that type of stuff. But the nursing home lobby is still very, very large and very, very powerful. So what has been done, and now that the governor is basically on lame duck status, which means that he's only going to be governor for until 2018, so this was his last budget. So the governor decided, there was a lot of money put in for nursing homes. The governor line itemed that out, the increase in funding, and they overrode this veto, which is something that I know was a priority for the governor his first 6 years. Also, Medicaid expansion was talked about an awful lot. That Medicaid expansion, they were going to take that away. They were going to limit Medicaid expansion back to the old rules and old limits. They were going to turn down the federal government's money that they were giving them if they had expanded Medicaid through the Affordable Health Care Act. Well, the governor, the House and Senate decided that they were not going to try to eliminate that, so the governor didn't have to line item veto that out, which he promised to do if that happened. However, right after they had overrode the governor's veto, the House Speaker came out and said, you know what, the Medicaid expansion issue is not done yet. So we're going to look at it again in the fall. I know that a lot of treatment, recovery, and mental health agencies have been advocating to keep Medicaid expansion because it has added so many more folks onto the roll so that they are able to afford treatment and to get treatment, whether for mental health or substance use issues. So we really, we are also in favor that more, as part of the public health model, that we are more talking about prevention, treatment, and recovery instead of incarceration, instead of other means that we're seeing some people take. And because we're in this addiction epidemic, I'm not going to call it a heroin epidemic anymore because it's not about heroin. The drugs are changing. We call it an addiction epidemic. We really need to focus on prevention so that people don't get started, that if they do, they make some choices, and addiction is a brain disease, that they are able to get the treatment that they need to overcome, and then they can stay in recovery. Those are all very important pieces to this issue, and this is not going to be something that's fixed overnight, but it's going to take probably, frankly, a generation to fix. So we really, have focused on that, and that is something that the House, however, is going to take a look at repealing that again in the fall. Also, really quickly, alcoholic ice cream is now legal in Ohio, which there was the troubling part about this is that with alcohol-related deaths at a 35-year high. There was not any debate on this. This is a public health issue, and yet they put it in a budget bill, which really has nothing to do with budget. It's more about a single issue, but they can slide it in. They can do what they want. They're the legislature. So now establishments, something to educate on, will be able to sell ice cream with alcohol in it up to 6% by volume. Also, an interesting piece that was added late was that casinos will now be able to offer free alcohol samples to folks who are playing in their establishments. This is something that casinos and alcohol, what a great mixture there, especially when you're applying them with free booze. It really is something that we are also concerned about, as well as the physicians do not now, even though this was put in the original bill, the physicians do not have to give the pros and cons of marijuana. They can recommend without providing any kind of recommendation on whether this is good, whether this is something that's going to counteract with other medications. They can give a recommendation without giving any of the facts, both for or against marijuana. Quite troubling, and something that I'm sure we'll take up in this next General Assembly. All right. So we have a medical marijuana update. 185 groups have applied to be a Tier 1, or that should say Tier 2 grow sites. This is what I get for writing this during WWE Raw. So Tier 1 or Tier 2 grow sites, 185 groups applied. Interestingly enough, most of the groups were folks we'd never heard of, but Responsible Ohio, there was a person from that organization, Chris Stock, who was actually he's a very nice man, but he's on the opposite side on this. He was a contact person for a group that had applied to be a Tier 1 grower, as well as former chair of Ohio Republican Party, Matt Borges. Matt Borges was ousted when President Trump came into office, and so now he is the contact for a Tier 1 marijuana grow in the system. So out of the 185 groups that have applied, 12 Tier 1 and 12 Tier 2 groups will be chosen. So the Tier 1 are the big ones, 50,000 square feet, big complexes, things like that. They'll be possibly able to expand to 75,000 more feet, 25,000 more feet if the demand is there. And so, like in Nevada, supposedly they ran out of marijuana this weekend, their first opening weekend there. So if there's that type of situation, they'll be able to expand. The Tier 2s are the smaller ones that will be under 10,000 square feet. These folks will be chosen, the winners, I guess you will call them, will be chosen in mid-August or early September, and they will have to start growing in September of 2017. That's when the growing will begin. So you will start seeing establishments pop up if ones in your community are chosen. And you'll probably start smelling it, frankly, across your community. So this is something that we really need to kind of focus on. There's not a whole lot of crime around grow sites or things like that. Possibly the smaller ones might have some issues, but the large ones, it's really dispensaries that have the majority of crime associated with them. So that's something that we need to pay attention to and look at in our communities. So there's also a federal marijuana update. So there's something called the Rohrabacher Amendment. What this is an amendment that was added to the last budget bill that basically took away the funding for the Department of Justice to enforce marijuana laws where it's legal either medically or recreationally in a state. So the DOJ, if there was something going on, the DOJ would not be allowed to interfere. It would have to be a state police issue. This has been, quite frankly, the boom that we've seen for a lot of the interstate commerce, interstate commerce that's out there, and we want to, we want to actually have this eliminated. And in this budget, in the latest president's budget, this was eliminated. So this would give the ability back to the DOJ, the Department of Justice, to enforce their marijuana laws on a federal level. It would be a lot more, it would hopefully squash some of a little bit of the black market that's going on between states. Also, I mean, when you look at this, Colorado has had one, before legalization, they had one filing of an organized crime unit that was in that state, that was in the Rocky Mountain state. However, after legalization, and because of amendments like this where you're not able to track this and not able to use federal funds to combat this, there are now, last year there were 45 filings of organized crime units in that state. So, it's basically organized crimes moving in, taking over industries, not only dealing marijuana. We're starting to see a lot more of the headlines that are talking about, legal marijuana growers using it as, pushing marijuana out their front door, heroin, meth, things like that out the back door, and then also sending it not only to other states in the union, but also overseas, which is what they're finding in Oregon. Oregon pot is across the world. In fact, 70% of all the marijuana grown and sold in Oregon is black market variety. So they're not catching it well at all. So we are trying to make sure that this rollback amendment is not added to the budget bill. There are some Congressman Polis, Rohrabacher, and some other folks trying to get this added to the budget bill. We could actually reverse the trend. If we can keep this out, this would give the federal government more ability to track these black market operators and also organized crime units. And there are two folks who are on this committee on whether this is added or not. Congressman Joyce, which is outside of Cleveland, has a little bit of Cleveland, but more of Geauga County, Lake County. It's more the northeast corner. He's a very important congressman in this, and we need to reach out to him if you are in his district, and I'm talking to you, Lyndon Matt, up in Geauga County. We need to reach out to him and really let him know to vote against this Rohrabacher amendment. Also, Congresswoman Marcy Kaptur. So that is covers from Toledo basically over to Cleveland, that very thin line that covers Port Clinton, Sandusky, Oregon. There's a little town called Oregon up there, Oak Harbor. That she is also on this committee that is overseeing and considering whether they add this amendment. So we really need to, I will send out something later today, how to contact these legislators. And even if you aren't in either of those districts, contact your congressperson anyway to let them know that this is something that you want them to vote against. That probably is very interesting. I think they're so used, congresspersons are so used to getting emails about how great pot is. When I write to my congressman or my senator, I have gotten letters back saying, I'm sorry we disagree, but then they use the talking points that I use. So they're really agreeing, but they just think because it's a pot letter, it's in favor of it. We really need to change that. We really need to change that dynamic. We need to change that conversation. This is an opportunity for us to start doing that and to keep this mess out of the federal budget. So I encourage you to contact your legislators. I'll send out something today later to make sure that we have that information, links to folks who are, to your congressperson, and just urge them, especially if you're in those two districts, Joyce or Captor, to really make sure that they do not vote for this, that if they do, they're basically voting for organized crime, and we don't need that. So thanks so much for that. So I was actually in a conversation a few weeks ago in the city of Denver, and it was, so the conversation was primary prevention versus harm reduction, not hard reduction. So I don't know what, and yet another, this is what I get for doing it during WWE. So harm reduction is really starting, especially in states like Colorado, it's really starting to take shape. In fact, one of the coalitions, the prevention coalitions, are focusing more on they're focusing more on harm reduction strategies than they are primary prevention. So they're getting away from teaching kids how to say no, what to do, those evidence-based prevention strategies, and they're moving towards, okay, we need to provide needles to folks who have, almost giving up the fight that we could stop anybody from doing this. Even though these statistics show that, the majority of people will not try a drug outside of alcohol, an illegal drug, in their lifetime. So this is something we really have to, in fact, it's something that I think somehow we need to discuss at a SPCA meeting or on a webinar or something like that, to talk about harm reduction, how we can put primary prevention back on the radar and not let the conversation go to harm reduction, which is again, which are needed, frankly. We do need to provide to stop the spread of HIV and hepatitis C and those types of bloodborne diseases from spreading through dirty needles. But we're moving towards things like opening heroin houses where people will be injected, and we're moving. Primary prevention dollars are being spent on these types of strategies instead of primary prevention. We need to get away from that. We also need to, I think, because we're going to be asked about it at some point, I'm guessing. You may have been asked about it already. There's been a couple of elected officials in the Southwest Ohio region. One was a Butler County sheriff who says that his officers will not carry Narcan. He said that a lot of times the EMT folks are there first, so they don't want to. They don't carry it for that reason. There's also a cost issue that is associated with that. And then, a week before this, the Butler County Sheriff, his comments were on the heels of a Middletown councilman trying to introduce something that would limit the ability to use Narcan in a person to 2 overdoses. So if they have overdosed twice, and this was the third time that an EMT or a police officer had come out to this person to try to save their life through Narcan, that would not be allowed. They would not have to give that person Narcan. So they're trying to limit it down there, I think, because of cost issues. This is something I think we need to talk about. What is our stance on this? Because we will be asked about it, especially as these types of situations and stories keep coming out. This was not on the state of Ohio news. This was national news. I read it actually in a newspaper in New Jersey. So this is something that is in a conversation in little town Trenton, New Jersey, that I was at last week. Something we need to discuss is not only as local coalitions, but also our stance from a from a SPCA standpoint, and also we definitely need to come up with strategies to keep primary prevention at the forethought and not have it lumped in so much with harm reduction strategies. Thank you for changing that, Brittany, to harm reduction, so that we can make sure our prevention dollars are protected, and that we focus on keeping folks away from this instead of just giving up the war. Finally, just released yesterday, the Drug Policy Alliance, which is an organization funded by George Soros, a lot of ties to the ACLU, came out with a report yesterday how we need to decriminalize and legalize all drugs. We're talking cocaine, we're talking meth, we're talking heroin, basically legalizing, regulating, and commercializing them, just like we've done with marijuana. Very, very bold report. You can see it on their website, which I'm not going to give their thing. You can find it yourself. But it is something that I think, this is our big fear about marijuana legalization, is that this is going to lead to other drugs, to other issues, and this is exactly what they're doing. They've laid out their plan, and I think we need to really start taking a look at this as a whole, not just marijuana, but how do we see this as a whole? How does this impact public health? And there's a lot of, quite frankly, I've been to some meetings where a lot of well-meaning individuals think that if we can regulate it, then it will not be such a bad situation. However, when you look at the stats, that 50% of people use alcohol on a regular basis compared to 10% of people who use marijuana on a regular basis, because alcohol is commercialized. Alcohol is led by a bunch of profit-driven strategies. You're going to see those numbers of other drugs climb up as well. So we really need to focus on those things. I will be, hopefully, I will be at the next SPCA meeting, so maybe these are some things we can discuss if you would like. And that does lead me right into this. So, Brittany?
Thank you very much, Tony. And just wanted to make mention that we've had a couple of individuals send in some chats to us letting us know that recent op-eds have been coming out in their areas, or different articles covering some of these divisive topics, certainly around marijuana. If you have examples of those and you think that they would be useful to some of the other communities out there, please feel free to share them. We will make sure that they are posted as links, and they will get out to SPCA e-news as well as to the legislative update. So I hope that we can be of use to you in connecting you with other communities that are doing the same. Tony, we don't have a lot of questions. July is quite the vacation month, so I applaud all of you for being on the phone today. But did have just one question right now in terms of what can be happening over the course of the summer, just to keep up relationships at a local level, doing grassroots advocacy while we're sort of in a slower speed.
I think, I did something earlier this morning for Sam that, we need to, while this time is off, especially while legislative sessions are off, there are a lot of town council meetings, taking vacations, things like that. This is when we need to be in their district offices, educating them, giving them, our annual reports, giving them, what is happening in our schools, what kind of surveys, leading them away. They have heard for the first 6 months of this year every kind of fact, both true and false, in their conversations. We need to give them, data-driven facts and data-driven, research-driven pieces of information that they can use to make good decisions. And this is the best time, not traveling down to Columbus, not having their mind on 8,000 different things that they have to have their mind on when they're down here, but actually being able to sit and have a conversation. I would invite legislators to or community leaders to a coalition meeting. Invite them to a little town hall or some kind of even smaller meeting, and discuss with them, what's going to get their attention is the heroin thing. So you can introduce it as that, but then you can go into other drugs. You can go into the importance of primary prevention. Start that conversation about primary prevention versus harm reduction, I think is very important. And just start touting our wares. You are the experts in your community. They have heard from lobbyists of all kinds throughout the entire year. And I'm talking from Vivitrol, I'm talking from Narcan, I'm talking from pharmaceutical companies. This is something that is, what your organization is doing is protecting the health and the safety of the community. They need to hear that too, because they're not, I can guarantee, they're not hearing that from any of the other of these lobbyists. They're focused, the lobbyists are focused on profit, and they're focused on selling their product. So we need to get in there, basically sell our communities who have elected them to the legislators, let them know what's going on, and take away some of the falsehoods that have been proclaimed throughout the legislative season. So that's something that I would encourage you all to do. Get into your district offices and see your legislators, see your community members. Great time to also see mayors and township council persons, things like that, especially with the marijuana piece going on. Dispensaries are next up. Also on the list for who's going to get those dispensaries. So, if you don't want, there's going to be 60 dispensaries in the state of Ohio. That's what it's maxed out at. Frankly, if it's like any of the other states, it's going to probably be in the lower income neighborhoods, frankly. So this is time to really focus on giving those myths a little bit of pushback, and giving your elected officials the truth. So a lot to talk about, a lot to do.
Thank you very much, Tony. Just as a last reminder for those, we are having our July SPCA meeting next week. This will be our last SPCA meeting for the year off-site. Once we have our meeting at the Dublin Recreation Center here in the Dublin-Columbus area in Ohio, we will be moving from September and beyond that back into the new Prevention Action Alliance facility here on site. We're very excited to bring everyone in and to have sort of a home here on site with PAA. But in the meantime, if you have not yet RSVP'd, you may do so by emailing myself or emailing contact@preventionactionalliance.org as we move through the transition into our new facility, as well as with our registration system. We're encouraging emails at this time for the RSVP to ensure that we have you for our counts for the week. Just as a quick insight into what we'll be talking about at the SPCA meeting, our themes are going to focus on how different sectors are engaged in environmental prevention. We're going to have some examples from local communities who've received some peer support as well as grant support around things like including youth in environmental prevention strategies through environmental scans, how to enhance a small grassroots effort to reduce prescription drug abuse in the community. We're going to be hearing a little bit about the successes, the pitfalls, the lessons learned when communities try to create asset developing initiatives. And so just a really good opportunity for folks to get a larger scope of just different types of things happening across the state, a chance for people to exchange tools as well as ideas. So if you're able to join us for the next SPCA meeting, please feel free to bring any of your tools or your knowledge in mind. It'll be a great day. It'll be a good summer break for us. And without any further ado, we'll let you go for the day. As always, if you have questions, do not hesitate to contact us. We look forward to hearing from you and serving you. All right, have a wonderful and safe day. Thank you so much.